The first case of COVID-19 in Uganda was confirmed on 21st March 2020. Confirmed cases are 170,694 and the death toll stands at 3,632. The president attributed the low numbers to people adhering to SOPs and COVID-19 National Task Force guidelines. The president highlighted that the vaccination figures in the country are well below the number of persons eligible for vaccinations, yet there has been a resurgence in the virus in some countries. He noted that the country has so far received almost 49 million doses of vaccines through donations and purchase, but only 26 million doses have been administered to the population.
So the boosting every 6 months is not only for the Bakaire, for the elderly?
Yes, it is for all the Ugandans 18 years and above. But we also brought on board children 12 to 17 years.
Okay.
By now, each category is expected to have been vaccinated more than once. However, the coverage worried the National Task Force. Health workers totaling to 150,000 are expected to have used 300,000 doses, but only 277,000 have been administered so far. The 550,000 teachers received 557 doses, representing 61% of those who have been vaccinated with 2 doses. Out of the 3.3 million elderly, only 1.5 million doses have been administered, representing 44% coverage. Only 73,000 doses have been administered to the armed forces, representing 29% of the 250,000 men in uniform. It is because of these low figures that the National COVID-19 Task Force recommended that a certificate of vaccination with evidence of up-to-date boosting is a requirement for entry into formal meetings and public places. The president went further to explain what the task force means by formal meetings.
Formal meeting means cabinet, means district council, parents association meeting in the school.
The same will be required to enter a passenger service vehicle. The new rule will be enforced in offices of all government ministries, departments and agencies.
We are going to instruct all the managers of those events, of the meetings, or the public gatherings, that somebody who does not have certificate of 2 vaccinations.
However, where there is no up-to-date vaccination certificate, a person will be required to produce at least a negative PCR test produced within 24 hours. The use of masks is recommended in all enclosed places and public gatherings. The president announced that these recommendations should be adopted and implemented with immediate effect. Patrick Senyondo, NTV.